Okay, guys, so today we're starting chapter 6. Now, you may ask yourself, why are we skipping chapter 5 and going to 6 and then coming back to 5? Well, the answer to that is chapter 5 is all about communication, and you're expected to communicate with people on their developmental level. And so it's kind of hard to do that until we establish what people's developmental levels are. So today we're going to start that chapter. You have 2 objectives today, and they are to differentiate between acute, chronic, and terminal illnesses. And you need to be able to give me an example of each different category of illnesses. You need to then, with your second objective, be able to identify how people are classified in the healthcare system. So there's lots of different ways that we classify people and so forth. So we're going to take a look at that. There is a link to the PowerPoint on the website, so I encourage you to take a look at that. So when we talk about people that we're taking care of, think about it when you're in healthcare. There's so much more to just doing the task at hand. Now, your book obviously focuses on being a nursing assistant, but this would apply to anything, whether you want to be a nurse, whether you want to be a doctor, whether you want to be a physical therapist. There's so much more than tasks. You know, for nursing assistants, they do so much more than just emptying bedpans or taking blood pressures. You have to get to know the people that you're taking care of. And it doesn't matter how well you can do your job. You can have the best training. You can be the most knowledgeable. But if you're not able to connect with your patients on that one-to-one level, then you're not going to be very successful at your job. So first of all, let's have a little review about the difference between patient, resident, and client. Of course, patient is anyone who's being taken care of in a hospital or an acute type setting. Remember, we talked about inpatients versus outpatients before. Inpatients being people who stay in the hospital, and outpatients that come and go on the same day. Residents are those people that we're caring for in the nursing home because it does become their home. And last but not least, the client is a home health care patient, if you will, that they take care of, because they actually go into their homes and take care of them there. So when people are diagnosed or they decide what's wrong with a person, their illnesses can be classified basically into 3 different categories. They can be classified as either an acute illness, a chronic illness, or a terminal illness. We're going to talk about the 3 of those. Acute illnesses are the ones that come on quickly and they don't last very long. In other words, you might be fine one day and the next day that you wake up, you're not feeling very well and you have these symptoms. They last a short period of time and those kinds of things. So usually you don't expect to get this kind of illness. Some of the ones that your books give as an example would be pneumonia, an appendicitis, and a broken bone. But you could take that as far as the flu, the common cold, or anything like that. Things that are short term, okay? Keep that in mind. A chronic illness, on the other hand, is something that develops over time, and it takes a while to get. And then you have it for a long time, maybe even for the rest of your life. So some of the examples of these types of conditions that your book gives are things like diabetes, asthma, arthritis, or high blood pressure, which in medical terms is hypertension. Think about those things. Once you're diagnosed with them, they just don't go away for the most part. You're going to have them for the rest of your life. You're going to have to learn how to control them, and they're ongoing. So that is a chronic illness. And last but not least, a terminal illness is one that someone is expected to die. Specifically, we say within 3 to 6 months they're expected to die, but not necessarily always in that time frame. We don't expect them to recover. So examples of these illnesses would be things like cancer, emphysema, certain types of heart conditions, basically something that the outcome is not expected to be good. We're expecting the patient to pass away. So those are the different classifications of patients as far as illnesses go. Now we're going to look at ways that we classify patients themselves. So when you're dealing with people, there's a couple different ways that we can group them. We can group them based on their age. Are they young? Are they old? We can group them based on their type of illness. Maybe a whole wing is devoted to broken bones, or a whole wing is devoted to a specific flu strain or something like that. Or acute illnesses, maybe on one floor, that kind of thing. Or the third way that we can group them is based on special needs that they may have. So when we are doing that in healthcare, we have quite a list of ways that we can classify our patients. And so that's what we're going to finish up talking about today. The first classification of a patient that we might see is a surgical patient. Just kind of like its name implies, these are people that have had surgery. And it doesn't matter what kind of surgery it is. Any kind of surgery, you can be classified as a surgical patient. So some examples that your book lists are an appendicitis and types of tumors. So if you have to have your appendix out, or you have to have a tumor removed, you have to have surgery to have that done. So you could be then classified as a surgical patient. You could be classified as a medical patient. These are patients who have some kind of medical illness, medical problem, and it does not include surgery. So maybe they need medicine, maybe they need physical therapy, maybe they need some other kind of medical treatment. Things like pneumonia, a heart attack, which is called a myocardial infarction, a stroke, which is called a CVA, stomach problems like stomach ulcers, things like that. Now, sometimes in some hospitals, they combine these two groups of people. And so if you ever hear the term med-surg, they're medical and surgical. So if you ever hear that term, that's what that is talking about. Another type of patient that we can classify is obstetrical patients. Now, these are women because they are people who are pregnant or have just given birth. And actually, we include any time from the woman delivers a baby up to 8 weeks after she delivers. That whole time, she's considered to be an obstetrical patient. Pediatrics are anyone under the age of 18. So children, adolescents, teenagers, this is what you guys would be classified as. Now keep in mind, as a healthcare worker, what that might entail. How you deal with a 2-year-old is going to be a lot different than how you deal with somebody that's your age. And talking with that person, you got to keep in mind all their developmental levels and all these things that happen during that time. For instance, if a small child is in the hospital, they may want to have their parents there when they get their IVs so that they can hold their hand or something like that. Whereas some teenagers would not want their mom there or their dad there. They wouldn't want to be asked the questions in front of their parents. So if you want to work in this area of healthcare, those are some of the things that you would have to keep in mind when you're caring for that group of people. Now, kind of at the opposite end of the spectrum, another way that we can classify our patients are geriatric patients. These are older people, typically 60 or 65 and older, depending on who you talk to. Now, the people who work in this area have other things that they have to worry about and things to concentrate on, because there's a lot of things that happen at this end of the lifespan as well. Things like the physical things that as you age, your joints wear down, you are more common to have arthritis, you're more likely to break a hip from a fall, those kinds of things. Mental effects, dementia, maybe Alzheimer's, all those kinds of things. So when you work in the geriatric field, those are the kinds of things that you would have to learn how to deal with and adjust to, so to speak. Another classification of a patient is a psychiatric patient. Now, these are people with impaired health. So sometimes they can be done on an outpatient basis. So they just come in maybe for therapy, or they come in for medicine, or they come in to speak with somebody, that kind of thing. But if for some reason they have been determined that they are a danger either to themselves or other people, they may need to be hospitalized. And in that case, they would have to be put into an inpatient type facility. Some hospitals have a wing dedicated to this type of patient. And then there's also standalone hospitals where everybody who goes there is a psychiatric patient. Another type of patient that you might see is a rehabilitation patient. So these are people who aren't sick enough to be in the hospital, but they're not quite well enough to go home either. They might need therapy. They might need some kind of IV medicine or what have you. So maybe somebody that has some kind of physical deformity, maybe somebody who's recovering from a stroke or a surgery and just isn't quite ready to go home yet. This would also include people who have substance abuse problems and have to recover from that. So drug and alcohol rehabilitation would also fall under this category. And again, sometimes, depending on how big the hospital is, you might have a whole wing devoted to this type of patient. Now, one that can be kind of confusing because we don't really see it that much around here is a subacute patient. Now, these are people that, again, they're not quite sick enough to be in the hospital, not quite well enough to be home either, but they can't really take care of themselves quite yet. So they might need IV medicines. They might need physical therapy. As you can see, subacute patients and rehabilitation patients are very similar. It's just kind of what kind of treatment do they need and so forth, and how they would be classified there. And last but not least for the day are our intensive care patients. These are people who need very specialized training. They might be a heart attack, a brain injury, brain surgery, a stroke, and initially right after it happens. The people who work in this area have to be highly trained. It's a very technical area, it can be very fast paced. They have to react in an emergency and so forth. But those are intensive care patients. So that brings us to the end of the lesson for today. But you do need to be able to, if I give you an example, so for instance, if I say to you, classify somebody who is diabetic. Okay, so first of all, you can classify diabetes into acute, chronic, or terminal. So that you would classify under chronic. But if I asked you to classify what kind of patient that would be, you could pick from the list, and what you would pick is a medical patient. So sometimes you can classify the illness and classify what type of patient they are, and you're going to have to do some of that on your test. So make sure you're reviewing some of those examples and you have a general idea of each type of patient so that you can do that for your test. So if you have any questions, email me. Otherwise, we'll see you tomorrow. Thanks, guys.